Ladies and gentlemen, welcome to the Medtech Impact Podcast, where you get to hear from leaders and innovators who are shaping the future of medical technology. I'm Kyle Cruz.
And I'm Richard Meiklejohn.
And we're your hosts of the show.
So, today on the Medtech Impact Podcast, we're delighted to be joined by Dr. Chris Anderson, founding surgeon and chief medical officer of Native Orthopedics. Chris, welcome to the show.
Hey, guys.
Chris, we have been dangling the line, and we're going to have a few fishing analogies today, and trying to get you to bite and come on here and have this conversation. We are finally connecting. The boat is set, and I'm looking forward to getting this story shared with our audience because it's a cool story, a lot of backstory to this. And again, I think it's really cool what you guys are doing. As always, when we kick off the show, though, we do like to tell the audience, what is that big problem that Native Orthopedics is looking to solve?
Yeah, so what we're going to tackle first is this problem with meniscus root tears, which is a growing epidemic in this country where the meniscus, we know is an important shock absorber in the knee. And if the root, which is where it inserts on the knee, tears, it renders the meniscus functionless as a shock absorber and has been shown to be one of the leading causes of arthritis in this country. So we're tackling ways to address that problem to keep it from developing into arthritis.
And like in terms of numbers, is this like a frequent injury you're seeing?
Yeah, well, it's interesting. If you look back historically, they called this problem the silent epidemic because it's been around forever. We didn't really recognize it until 1991. It was first described. And it really wasn't until around 2010 or 2012 it became something that was more recognized. And around that time, it was kind of just described as something, maybe there's 100,000 cases every year in this country. But there was a study that was actually published in 2015 that showed up to 80% of patients that have a knee replacement at the time of surgery, when they open up the knee, they identified a meniscal root tear. And so there's 1 million knee replacements every year in this country. So that suggests that there's at least 800,000 people that have a root tear. Now, the question with that is that did that root tear happen? And was that something that was kind of undertreated or under-recognized that then eventually led to that arthritis? And those are questions we're still trying to find the answers to, but we know that it seems to be a much bigger and more profound problem than we had originally anticipated when this was first described.
And in terms of the injury itself, is this like always a stress injury, or like what are the causes that lead to this happening?
Yeah, great question. There's two different mechanisms we see. One is in the young, athletic population, and usually coupled with like a cruciate ligament injury, like ACL tear, playing sports. So more high energy stuff. We see a lot of those. And then in the other cohort, you usually see this as more of a kind of almost something in a slightly degenerative knee in somebody who's 50 plus years old. And those are usually kind of a lower energy mechanism, bending over to pick something off the ground, kind of twisting, going up the stairs, and they feel a pop in the back of the knee. And they had a slightly degenerative root that just tore, kind of like we see a lot of degenerative rotator cuff tears. It's very similar. It's almost analogous to that in the knee.
This is fascinating because, Chris, I'm going to tell you something right now, and the audience doesn't know this, but I am a break dancing maniac, okay? And I'm telling you, I think I might have torn my meniscus. I was at my friend's wedding, all right, and I'm spinning on my back doing the windmill, and I get up, and I'm like, oh my gosh, my knee's instantly swollen. But, the swelling goes away, the pain goes away. Maybe, I'm not breakdancing as much now, close to 40, but hey, get me on a dance floor and you never know what will happen. But I might have this problem too. So like, how do you help patients or like, how do patients kind of seek treatment, and do they even know to seek treatment, before it's far too late when they're experiencing, obviously now, arthritis potentially?
Well, I mean, it's two things. One is the patient. We need to, more public awareness, obviously, that if you have a pop in your knee and you injured your knee and it's swollen, you need to see somebody. Nowadays, we're paying a lot more attention to this particular diagnosis. So when you present to the doctor with this, a lot of times, if it's a sports medicine trained physician, they'll be looking for this diagnosis. And our radiologists are really keyed into it also. And it used to be something that was very hard to identify on an MRI, but now radiologists are really actually looking for this injury because we see it so often now. But I think not only is the public awareness important, but also physician awareness is really important. This is a new thing. It's a fairly new phenomena in the scheme of meniscal understanding dating back to the 1500s when Vesalius first described the meniscus all the way up to now. I mean, this is the newest thing that we're dealing with, quite frankly. And so there are a lot of surgeons out there that are not really up to speed on kind of the treatment of meniscal root tears and identification and stuff like that. So something that definitely we need more awareness on the surgeon level as well.
Yeah. What's the current standard of care? What does the treatment look like today?
Yeah, so the current standard is what we call transosseous repair, and that's where you take a guide and you drill a tunnel up into the knee, and that tunnel goes into the insertion point of the root on the anatomic insertion point on the tibia. And then you take sutures and you put sutures through the root, and then you pull them down through that tunnel, and usually you tie those sutures over a button on the tibia. We call that transosseous repair. And it's actually really interesting because, when I first started treating these, you kind of realize that there's just got to be a better way. And it seemed like a really neglected problem that nobody really bothered to fix and or improve upon. And I started investigating this, and I actually came across some interesting literature that the first time that soft tissue was repaired with sutures and using knots to secure it back down was described by the ancient Greeks thousands of years ago. And it kind of just dawned on me. It seemed almost insane that here we are, and nobody's bothered to make that better for this application. And so that's when I really kind of thought, there's a solution for this. We just haven't discovered it yet.
So this is old school, like your breakdancing.
Yeah, sure. Well, my breakdancing actually, come on now, it's timeless. But tell us, Chris, how is Native looking to then improve the way these procedures are done today?
Yeah, I mean, when I thought about it, I kind of realized that, when you're tying knots, it's a labor-intensive process. It's highly variable. Some people, if you look at studies on knot tying, and even in experts, you get this variability. And with variability, you get error and you get problems. And it turns out that if that happens in this setting, you get a bad repair, or, the other issue with knot tying is it's static and you get loosening that occurs pretty quickly because the meniscus is obviously soft tissue and it has viscoelastic creep to it. So it loosens up, and it loosens up almost instantly. And so not only was it labor intensive and cognitively demanding, but it's a static repair that loosens very, very quickly after surgery. And so I started thinking of ways that, we could fix this easier, better, faster, simpler, more efficient. And I kind of realized that I had developed a skill set for creating a device for this early on when I was growing up, and that I did a lot of fishing. And turns out there's a lot of parallels between fishing and knot tying you do for fishing. You don't want to lose that fish. You got to have a good knot. And surgery, you don't want to have a bad knot and have a poor outcome. So I actually learned how to splice together fishing lines using a hollow core line, and use kind of a finger trap mechanism, that little toy you play with when you're a kid. You stick your fingers in there and you get locked in. You can't pull them out. You got to grab your mom and get her to rescue you. So we use that finger trap technique to join lines together. And it kind of dawned on me that I could use that for an orthopedic device to create a knotless and retensionable device. Now, it's really important that it's knotless because you don't have to tie knots. It's super easy, but it's retensionable. So when you get the creep out of the system intraoperatively, you can sit there and retension it again and get better biomechanics and better secure repair.
It's crazy because it's, again, always the simplest things, but it's what makes the magic happen when you can engineer something like that. Actually, when you're carrying out the procedure now, tell us a little bit about, I know you've spoken about before the previous, but is there any change to the procedure with what you're doing, or is it just, again, following that same protocol?
Yeah, no, that's one thing about this that's so special. I think, when we set out to kind of create this system, one of the goals was we didn't want to change the workflow of the surgeon. Surgeons are used to doing transosseous repair. We just thought, how can we address all these pain points and make the problem easier for them to deal with? So we're not changing their workflow. We still do transosseous repair. We still have to put the suture through the tissue. The only difference is instead of having to sit there and try to tie these knots down, which are static and you can't retension them, you put the sutures through and you loop it over through the meniscus, and you loop the sutures over a button, and then you pull the adjustable strand, kind of like a zip tie. So you just pull it and it zips the tissue down and holds it in position.
So you were talking about before the button. I mean, like, is that removed? I presume, like before you close up, or is that left in there? I'm kind of fascinated now. If you're getting one of these, are we all walking around with button knees?
Yeah, no. It's very common, and we've been using buttons for fixation in orthopedics for decades now, and it's pretty much the standard to get that good solid cortical fixation. We've got one version that uses a titanium button, which is the industry standard for these types of repairs. But we have a second version, which is really exciting, and it's made of we call it the soft button, because it's made of a polyethylene material, and it's a tape polyethylene. So when you pull it through the tunnel and you tension it, it mushrooms against the cortex, and it forms a kind of an anchorage point on the cortex. And the cool thing about that is that unlike a traditional metal button, which interdigitates with the bone and it has some prominence to it, what we found in testing of this is that it kind of melts into the periosteum, and then when you rub your thumb over there, over where the implant is, you can barely feel it because it's kind of interdigitated into the periosteum. So in terms of being low profile and kind of leaving very little footprint, and being a light touch surgical solution, we have that as well, which is really awesome.
So what about the Dragonfly? Because we're talking fishing talk here, right? But your product is called the Dragonfly.
Yeah.
So help us understand, how you came up with this name.
Well, we wanted to pay homage to the roots of this whole, system. And really, the concept was thought of through an idea with fishing. And then we kind of thought, well, how can we bring that in? How can we pay homage to that? So we it turns out that dragonflies are important for fly fishing,
Yep.
and people use dragonflies as lures for fly fishing. So that's how that came about. And if you look at our non-disposables, so we have a drill guide that's really awesome drill guide. It works great. It really improves upon, the technique and making it a lot more efficient for the surgeon. But if you actually look at the form factor of the drill guide, it's got a unique appearance to it. The handle has these vents in them where we kind of cut out of the handle to make it a little bit lighter weight. But that's actually something that's been done in the fly fishing industry for years, when they take reels and they'll actually cut designs out of the reel to vent them as well. So we kind of made it almost look like if you compare our guide to some of these modern fly fishing reels, it looks a lot like that. So we try to the branding is all tied into fishing and paying homage to that.
Very cool, very cool. So we love the simplicity. Obviously the functionality sounds fantastic. I'd love to hear more about where are you on this journey. So you've got this prototype or product. Again, where are you in terms of that clinical use case and actually seeing this in action?
Yeah, so we got our FDA 510K clearance in late March, and so at this point we are getting inventory stocked right now, and we're working towards the goal of launch first in human probably around Father's Day, 4 to 6 weeks from now.
Very cool, very cool. And I guess if you're talking about Father's Day, that we should really touch on your history in this space. This is very familiar for you, I think, and you've been on quite the journey as much as this technology's been on its own journey. So, I think you shared with us a drawing when you were only 10 years old. And so, yeah, maybe you could talk to a little bit how much of this has been brewing, and I guess, again, the fruition of all this.
Yeah, so as far back as I can remember, fishing was really a passion of mine, but I feel like orthopedics was truly a calling for me. And I found some old papers at one point from I don't know, my mom had them. So they were in a big box, and I was just kind of looking through, and I found a journal from I was 10 years old. They made us write every day as a part of the school day in a journal, and I was flipping through it, and I randomly came across this picture that I'd drawn, and it was a sketch of the knee, and I drew out the ligaments and the femur and the tibia and the patella. The spelling was horrible. I don't know if you saw it. It's pretty funny, but I feel like that orthopedics has always been a calling of mine. And I'm just fortunate to be able to have gone into this field and hopefully have an impact. And really, when I think about what our purpose and what we're doing, and I believe it really is a noble effort to try to help surgeons uh, help empower them so they can restore the native anatomy of their patients in ways that haven't been done before. And for me, that's very gratifying to be able to help other surgeons help patients. So, one of our core tenets is we're patient centered, but we're surgeon focused, and I believe in that mission.
I love
Yeah,
that.
well,
You
we
know
can
what?
hear this.
Yeah, and you know what's super cool too is I think like, a lot of people in life where they end up, there's a story to tell like your story, right? There's something that they were super passionate about when they were maybe a small child, and your story is way better than mine. I used to rollerblade down the Cape Cod Canal with a wagon full of soda and water and sell them for $1 each, but I was a hustler, I'll tell you that right now. And no one sold more soda and water on the Cape Cod Canal than I did. And I made a great living doing that. And here I am in sales and marketing today, right? Very important to me. But I certainly wasn't journaling. And I'll tell you right now, I wasn't drawing pictures of knees and ligaments and tendons. No, really inspirational, though. I think that's fantastic. And I think it's a kind of like, one of those things that, I don't know, really inspire people out there when they hear things like this, right? To be like, oh, well, what are you truly passionate about? And I think it comes very natural to a lot of us, right? Because it's something that's been inside of us from a young age. So really cool to hear that.
Yeah, Kyle, you've obviously just been working on becoming
Yeah.
Chris's next patient. I think it's getting that
Yeah.
rollerblading in there. Here, I'd love to go back to what you were talking about, though. So we've got this amazing foundation, which is clearly all in the roots, if you pardon the pun. And you were talking about this, the first clinical case use. Where is that happening? And tell us a little bit more about that.
I guess it depends on who has the first patient and who gets the first kind of the first set in to do it. I'd love to be the first person. I think one thing we have to do is clear through some of these value analysis committees and make sure that we're good there. There'll be some headwinds there we're facing, but always is. But I think we'll see. We've got demand for it right now. We actually have doctors almost on a daily basis asking when it's going to be ready. So we're excited. In fact, we had a guy yesterday. It's like, we need this now. I need it right now. So we're looking forward to getting it in people's hands as soon as possible.
Well, that's what you want. You want them chomping at the bit. And I feel like the other part we need to bring into the table is you've got a very cool team of experienced, professionals who are supporting. So maybe we could tell a little bit how that came together as well.
Yeah. Now, first of all, I'm just so fortunate to be with such like-minded people that we're all on this mission together, and I just couldn't be happier to be with the team that we have. That goes back to, when I originally conceived the idea and started patenting and creating a patent portfolio around this core idea. Around that time, I'd shopped it around to some of the strategics and actually got a lot of traction and had a couple of offers, but I just thought, they move pretty slow. I want to move fast. I want to get this in people's hands, and decided to kind of go in a different direction. And along my journeys, I'd met Tom Gamache, and around the time that I kind of wanted to start a company, I'd heard that he had separated from J&J, and we decided to kind of link up and form Native after that. And he kind of put together a team, with Sam Grossman, who's our chief technology officer, who's a just great guy and brilliant engineer. And then our marketing guy, Brian Morley, he's just genuinely very, very talented person. So that's our core team. And, we are all very like-minded, hardworking people. We want to we're on a mission to bring this to market ASAP, and we're moving very quickly. Everything's just coming together at a rate that which, is pretty awesome. So we're excited about it, but we got a great team. And we're just very fortunate to have so many people around us helping us with this.
Yeah, well, we know Tom very well. Richard and I, we were blessed to put together the startup stadium at MedDevice Boston last year, where Tom did an amazing job representing Native, and we were able to see your product on display, and you could tell there was a lot of buzz around the technology, and it's just been fun. It's been a fun journey, not just learning about your product, but now seeing you guys make such great progress. And now here you are just about to launch your product. So kind of what does that look like? Are you building out a team here where you're going to have salespeople that are going into hospitals? Or are you looking for distribution partnerships? How will that work?
Yeah, it's mainly distribution partnerships. And we've developed through there, industry connections, a pretty broad network of distributors around the country. They're going to be driving the sales side. So that's where we'll start for now, and kind of just see where that goes.
I love it. Yeah, well, maybe what you can do is you can put together some fishing trips, right? To go ahead and make some content, if you will, and have some fun and tie it all together. Sorry, that was super cheesy.
Anytime I can get out, I'll take advantage of that. I will say, Brian had one of his buddies, Pete, use the Dragonfly. He tied it onto his fishing line and then tied the hook to the Dragonfly and caught a bunch of stripers with it and videoed it, which is pretty entertaining.
That's great content. That's awesome.
So it's good content. Yeah, that's good content.
Well, the audience were forewarned there was going to be some fish puns, and the missile is not disappointing. Tell us more. Like, so you got this first in human coming up. What lies ahead in the next sort of 12 to 18 months?
So one thing that is really, really cool about the Dragonfly is that we're not just in the one root repair market. It's actually a scalable technology. So we could use this for indications really in all through sports medicine, and maybe even outside of sports medicine. We've been approached by some people in spine and other areas that want to potentially expand the technology into other areas of orthopedics. We have a number of prototypes. We're going to be doing our next FDA submission for broader indications coming up in the next couple of months. And then we have prototypes for ACL repair, suspensory fixation for ACL reconstruction, other reconstructive techniques. And then we'll be coming out with some other products following that that will be for other indications as well. So we've got a really exciting pipeline. The cool thing is this technology opens up a lot of ways to do knotless fixation around the body that haven't been previously done before, in ways that will make soft tissue repair a lot easier and better.
Well, you teased us with the rotator cuff. Is that an area maybe?
Yeah, we have a lot of interest in that, and it's certainly something we're looking at.
Neat.
Very cool, very cool.
It's a big market. It's certainly on the radar.
Yeah, it's a lot of opportunity, it sounds like. And so for people who want to come fishing with you, like, where can the crowd find you? Like, where's that boat going to be landing? Are you heading up any events coming soon, or what?
We'll be at AOSSM. We'll have a booth there. So come drop by if you're there. Love to see and talk to you. You can also check our website out, nativeortho.com. And those of you that are out there that are listening, I mean, we'd love for you to follow our journey on LinkedIn. We've got great content on LinkedIn. We do regular updates and, try to keep it entertaining. So if you want to follow along, that'd be great.
Yeah, you guys definitely do a great job on there. And your website's awesome too. I mean, the pictures, the videos, it's super clean. Really easy to learn about the technology there. So well done.
Yeah, we put a ton of time and energy into that. And really, honestly, the social media stuff too. That's Brian's baby. And, I think for where we're at with our team and our funding level and stuff, I can't believe we've done so well in those areas. But it really is awesome to see.
Yeah, very cool. Hats off to Brian. Content is king. For anyone listening, make sure you are putting that content out there. And head over to that Native Ortho website for a great example of how you do it. Because I think, again, going back to how simple this design is, if you go to the website, how simple the design is of telling that story as well, it's beautifully weaved together. So, again, hats off to you guys. Tell us, if people want to get in touch, what's the best way to do it, Chris?
We have if you want to reach out to us, DM us on LinkedIn or go through the website. That's probably the easiest way.
Awesome. Well, I think for anyone listening, they're going to be intrigued. They're going to hit up that website, get on that LinkedIn, follow you guys, check out what you're doing, and excited to hear more about these other products in the future, because it sounds like there's like a really great pipeline of stuff coming through. So thank you so much for coming on and sharing the Native Ortho story.
Awesome. I appreciate it. I can't wait for the future for this company.
Fantastic. Well, ladies and gentlemen, another huge thank you to our guest, Chris Anderson, founding surgeon and chief medical officer at Native Orthopedics. And thank you for tuning in to another episode of the Medtech Impact Podcast. I'm Kyle Cruz.
And I'm Richard Meiklejohn. Until next time, keep innovating.